jump in the chat, and I'm sure Jay would be welcome or happy to kind of respond to some additional questions there. We're next going to turn to Nadia Bay, who's one of our undergraduate scholars. She's a junior studying biology and global health, and one of our first year undergraduate scholars. And so she's going to be talking about some of her work on digital health equity. So Nadia.
Yeah, thank you so much for the introduction, Jillian, and thank you to everyone else for being here. As Jillian mentioned, my name is Nadia Bay. I am a first-year undergraduate Margolis Scholar, and I am a junior studying biology and global health. And today we'll be discussing factors that impact access to telehealth for North Carolina farm workers and how we can expand access statewide. So first, I just want to give some background on how I came to this topic. For the past year, I've been working with the KBR Telehealth Disparities Project at the Margolis Center. And my primary focus on that project has been on musculoskeletal health and how telemedicine is used for people with those conditions. And one area I really honed in on was musculoskeletal pain as a result of occupational exposures and essentially work activities. And I found a lot of research on things like truck drivers, nurses, a lot of those occupations that include a lot of movement. And I didn't see anything about farm workers. This really made me curious, since I know that farm workers do a lot of manual labor out in the fields or occurrence wherever they may work. And that kind of got me thinking about like, what does telehealth use look like for farm workers? And so in fall 2021, so last semester, I pursued an independent study that sought to answer the question of how farm workers use health services, especially telehealth. So some background on farm worker health. Farm workers are more susceptible to chronic conditions such as hypertension and diabetes, as well as low back pain as a result of the work that they do. That's in addition to acute conditions such as occupational injury or other illnesses. There's also gender differences in the tasks that farm workers may perform in their daily activities. Most farm workers are male, but there are female farm workers as well as farm worker spouses, and they may have different activities on their work sites, so that can lead to different health outcomes as well. Farm workers also experience barriers to care, such as language barriers, a lack of health coverage, particularly for migrant farm workers, and provider and employer discrimination. And one thing I found was that farm workers most often visit community health centers and or migrant health centers, since they're generally low cost and accessible for those populations. And so as a result, I started looking more into health centers and how that could impact healthcare access for farm workers. So according to federal data from the HRSA, out of 42 federally qualified health centers and lookalike centers in North Carolina, 27 of those serve farm workers and their dependents. And that's just the number of centers that served a number greater than 0, or they didn't leave the section blank. And 25 out of that 27 administer telehealth to patients, and that's video telehealth. However, one thing that wasn't included in this data was how many of those centers actually administer telehealth to farm workers directly. Those are just kind of separate data points in the data set. So I started looking into whether certain centers administer telehealth to farm workers directly. And I started reaching out to federally qualified health centers and lookalike centers in the state. And so out of the 5 or 6 centers I reached out to, only one actually got back to me. So I was able to have an informational interview with one health center in North Carolina. And this particular center serves approximately 1,000 farm workers and their family members per year. Some patients leave throughout the year because they're on temporary work visas and they may return to their country of origin, while others that are more established in the local area may visit up to 3 to 4 times per year with their families. And although telehealth use kind of increased during the pandemic, as it did in other areas, it has declined due to access issues. Most farm workers don't have the requisite technology in order to attend telehealth visits, like they don't have broadband or they face other challenges of access. And in general, telehealth is not really proposed as a separate option for farm workers because it's just generally assumed that they won't have the ability to take advantage of it. And patients are encouraged to come in person in order to get dental services and other services that may not necessarily be accessible virtually. And as a result of these access issues, I started looking at broadband and essentially how we can expand broadband for this population. So why expand broadband? Of course, it increases access to video telehealth. Audio telehealth is generally more common among people with access issues, but it's actually very difficult to contact farm workers because a lot of them do end up changing their phone numbers pretty frequently, especially if they're migrants. So generally, what I learned from the center that I spoke to is that they leave the center's contact information at farm worker camps so the farm workers can contact them rather than the other way around, because they generally can't get in contact with that population. So in general, expanding broadband would help create a more consistent connection between health centers and farm workers. And additionally, expanding broadband would bridge the digital divide for other needs, such as connecting farm workers with resources in their community. However, there are challenges to installing broadband. According to state data from 2020, about 34% of survey camps lacked wireline internet, and location really matters for this. According to a study in 2015, about 34% of camps in the Triangle area, which is represented by this visual down here, were considered hidden camps, which means that they're far away from main roads or they're hidden behind other structures, and that really impedes the ability to install broadband in those areas. Additionally, I was able to get my hands on a list of registered camps in North Carolina from the Department of Labor, and this data essentially includes like how to get to the camps and like what these camps look like. And a lot of the data included notes like GPS may not pick up this address, and some had no addresses at all. And then even for the camps that did have direct addresses, this is a screenshot from Google Maps from one of the camps I looked up, and the pinpoint is essentially in a patch of trees. I couldn't even locate the building when I looked for this particular location. So that just shows how difficult it is to even locate these places, let alone install broadband. And an additional issue is that a lot of migrant housing is built with metal or concrete, and those types of materials really reflect Wi-Fi signals. So it's hard to get Wi-Fi signals in those buildings, and it's also hard to install broadband. There was a recent article from North Carolina Health News that found that and growers couldn't really install broadband in those types of migrant housing because it was more expensive, and they're being quoted like into the thousands essentially. However, on the bright side, North Carolina already has a variety of initiatives to expand broadband for this population. For instance, the state budget has the GREAT program as well as the Completing Access to Broadband grant program, and these essentially expand broadband access in rural areas and underserved economic areas. There's also the Migrant Housing Internet Connectivity program, which is exactly what it sounds like. They install internet connectivity in migrant housing. There's also the MiFi Hotspot Lending Program that aims to give hotspots to migrant housing. And this is considered one of the fastest ways to expand internet access rather than going through the process of installing broadband in certain areas. There are also local partnerships that focus on health and broadband needs. For example, in Surrey County, Surrey Medical Ministries partner with a local broadband company to install broadband for these populations and sort of expand their access as to both the internet and to telehealth. And there's also the state community health grant for community health centers. And although this is not specific to telehealth, it does include a provision to develop telehealth infrastructure and fund those visits. However, I think we can improve on the initiatives that we already have. For one, I believe that North Carolina should continue to invest in broadband programs statewide. The current programs that I mentioned, such as the Completing Access to Broadband program and the GREAT program, are kind of focused on rural areas broadly. And although that indirectly benefits farm workers, I think targeting policies toward migrant camps specifically to implement broadband would be really helpful, especially because it would help us address specific needs that exist in those populations. Additionally, I believe that the state should distribute more funds to health centers for telehealth infrastructure. And since the program I mentioned on the previous slide, the Community Health Grants program, that is an application-based program. And although it's helpful for telehealth use, I think it would be good to give more funds without an application-based process. Additionally, neither federal nor state policy for migrant housing includes a provision to require internet access. And I believe that at both the federal and state level of this should be added. But since this presentation is about North Carolina specifically, my specific recommendation is to modify state migrant housing policy to require internet access. There's also some areas from future research that I identified based on like what I've said in this presentation. For one, I did try to achieve this, but I think it would be good to survey which existing health centers administer telehealth to farm workers, or since we don't really have a quantitative body of data on that. I think it'll also be good to gain a better sense of telemedicine use in farm camps. There are some studies on telehealth for specific conditions like dermatology or use in specific scenarios, but I think getting a broader overview of what that looks like will be helpful. And I believe research should look at other determinants such as the total percentage of hidden camps in North Carolina, how telehealth will be financed, both for installation of broadband and also how reimbursements will work, as well as gender differences in use and the downstream impact on youth and families. And yeah, I just want to quickly acknowledge everyone that helped make this research possible. First, the Margolis Center for providing a lot of support to me over the past year, as well as allowing me to present today. The Global Health Institute for supporting my independent study, the Library Center for Data Visualization for helping me develop that graphic, like that you saw a few slides ago, the Farm Worker Health Program, Piedmont Health Services, and the Department of Labor. So thank you all so much.
Great, thank you. So Nadia has time for a question from folks. I did see Jonathan had asked whether the 330 grant was it, or whether it is the 330 grant for community health centers, or was it another type of grant? And I don't know if you are aware of that.
Yeah, the 330 grant would be for migrant health centers specifically. The HRSA data that I cited wasn't specific to 330G, but it did include centers that did receive that grant, because there are some health centers that serve migrants, specifically having the migrant health funding.
Other questions from folks? Okay, well,